We are the Ray family, so my name is Will, and this is my wife Olivia and our daughter Bonnie, and we are from North Carolina.
Bonnie was 5 months old when she was officially diagnosed with Hurler syndrome.
The University of Minnesota has for decades been a central location for the advancement of care for these kinds of disorders.
We feel like we're in the best place possible for Bonnie's care.
For genetics, this is the time, and this is the place where therapy for genetic diseases can finally begin to take place.
The Inherited Metabolic and Storage Disease program here at Minnesota was established back in the 1980s. We were the first institution in the country to try blood stem cell transplantation for lysosomal storage disorders. And over the period of the next several decades, really, we continue to offer new therapies and develop our expertise and hopefully be able to offer better therapies to these patients moving forward.
When treatments are approved by the FDA is happy if you can arrest the progression of the disease. That's enough for the FDA, but that's not enough for us. We want to see if we can take it farther.
We are in the forefront and right smack dab in the middle of the new advancements in therapies, such as gene therapies for these disorders.
You're seeing patients with metachromatic leukodystrophy, which is a rare neurologic disorder, and we're the only institution in the country that's been able to treat these patients with gene therapy. So we've got 4 patients that have been treated thus far. Their treatment course has been much easier than one would anticipate if we were using blood stem cell transplantation, for instance. Their enzyme levels tend to be higher than we can achieve with transplant. We're also interested in peroxisomal disorders, and those affect the central nervous system. And transplant has been used for those diseases historically. But again, we'd like to be able to make the process safer and help the patients have a better opportunity for long-term outcomes.
In this group of conditions, storage disorders, adults who have those have already suffered irreversible harms. For many of the diseases that we're talking about, people might not survive into adulthood with the most severe forms of the disease. So obviously, the place where you can have an impact, the place you can make a difference for people with storage diseases is tackling them as early as possible. Traditional newborn screening has been to do early and pre-symptomatic diagnosis for rare inherited metabolic diseases. And so the thing that's evolved is that they've started screening for a new scope of disorders that include storage disorders.
So Bonnie's experience was a little unique. Normally, or sometimes, MPS 1 is picked up on the newborn screen, but it was added to the newborn screen in North Carolina a few weeks after Bonnie was born. So Bonnie's newborn screen was normal, and so we had no concern until she was about 4 months old, when they noted at her pediatrician's office that her head circumference had increased exponentially. And they also noticed an abnormal curvature of her lower back.
In 2017, the state of Minnesota started newborn screening for adrenoleukodystrophy. Shortly thereafter, Dr. Gupta here at the University of Minnesota developed a registry for individuals with adrenoleukodystrophy. The registry has helped us understand some of the characteristics of families, how many children in that family are going to develop adrenal insufficiency, how many will develop brain disease. Are there some genetic differences that won't have a phenotype at all, that they're going to show up on newborn screening, but none of the family members are going to have disease? So I think that the newborn screening program and also the ALD registry have been great partners.
One of the things I think is important to understand is to offer optimal therapy for these patients and treat them as best we can. It takes a dedicated team of multidisciplinary people to serve the patients.
Having those groups have time to sit down and talk about the condition, work together as collaborators in research protocols, has been really fostered here at the University of Minnesota. As part of that, we've become a center of excellence for the National Organization for Rare Diseases.
It affords us an opportunity for exchange of knowledge, for advancement in research activities, and for the exchange of best practices in care for people with rare disorders. It's not something any one organization do by themselves because of the very nature of what is rare. So we were very proud to be part of that group.
When you're reading just the academic journals or the research that's happening around the world, you're seeing the University of Minnesota staff on most of those papers or their names. And so you realize when you're coming here that you're getting the world-class care, the best care possible for your child.
Bonnie has a rare disease, but Hurler syndrome is not rare here at the University of Minnesota. Everyone is familiar with it, down to the rad tech who's helping with imaging. And so just the experience has just made it the best place possible.